Hi everybody, Dr. Jay Greenstein here. Today I'm going to put on my Vice Chairman's hat for the Council on Chiropractic Guidelines and Practice Parameters, otherwise known as CCGPP. We now refer to CCGPP as the clinical compass, as it's just so much easier to say. So today's discussion is going to be about the G word, or guidelines, and why it's so important in today's practice. You know, every single day, if you're dealing with an insurance company or these third-party administrators that the carriers hire to manage the chiropractic benefit, you know that we're in a war. And the denials that take place in our offices on a regular basis can be fought, and it can be fought with the appropriate weapon. The appropriate weapon that we use and that we need to use more often, and why I'm talking to you today, is because the perfect weapon to use to fight these denials and the insurance company abuses are clinical guidelines. Now, this is an example of the chronic care guideline that was done several years back. And the reason why guidelines are so important is because clinical guidelines are literally the highest level of evidence that support what we do every single day in clinical practice. So it's really all about using these guidelines to protect your practice and your patients that you serve. If you go to the Clinical Compass website, that's clinicalcompass.org, all the resources will be made available to you. They're all there and they're free. So check out the website on clinicalcompass.org, and if you go to the resource page, you'll see that all the clinical guidelines that we have are listed there. You click on the link and those clinical guidelines are made available to you. Whether it's individual doctor practices, state associations, or national associations, the Clinical Compass, or CCGPP, has been working hard to protect every single one of you out there and your patients that you serve. An example of this is when Care First, which is the Blue Cross Blue Shield organization in the national capital area, DC, Maryland, and Virginia, had a policy that they would not cover spinal manipulation for kids 12 and under. Well, luckily for the profession and the chiropractors and their patients that are here in the DC region, we sat down with them and we showed them the pediatric guidelines, which talks about how it's appropriate to take care of pediatric patients, as well as the safety issues, really all the evidence-based guidelines that supports what we do in clinical practice every day when we're taking care of these kids. And at the end of the day, after that discussion, they ended up reversing that policy. So clinical guidelines, again, very, very powerful weapon to deal with challenges that we face with insurance companies on a day in and day out basis. If you have challenges in your practice, it's important that you go to that website, clinicalcompass.org, click on the resource page, and those clinical guidelines are made available to you. In addition, we have what's called the Rapid Response Resource Center, and you can actually tell us what's going on with your problem or with your challenge as it relates to the carriers or reimbursement or an insurance denial, and we'll respond to you and tell you exactly what you need to do, what guidelines you need to use in order to help fight that issue. In addition, the Clinical Compass has created clinical algorithms for you to use in practice. Now again, guidelines and algorithms, they're not a set standard per se. You don't have to always follow every single guideline exactly the way that it's written, or an algorithm exactly the way that it's written, because we realize there's different factors that tie to patients' conditions because each individual patient is different. But essentially it is a guide, and it's a helpful guide. This is an example of the algorithm for the chronic care patient, and it also has the documentation necessary, including the comorbidities and complicating factors that tie to, according to the evidence, a need for an increased amount of care. So the guidelines literally will help you support, when a patient is really complicated, it will help you support the need for care. So if a third-party administrator or an insurance company denies you after 2 visits or 4 visits or 6 visits, you need to use this guideline, the evidence, to fight those denials. In addition to the algorithms, we've also created apps for you. So you can go to iTunes, you can go to the Google Store, and you can download it for any Apple product or Droid product as well. You can literally have it on your phone or tablet, and you can use this algorithm to talk to patients about why they have this particular treatment frequency and duration, and you can use it to plug your patient's information in to know how to take care of them in terms of the evidence and the best course of care for them. We've gotten a lot of praise from a lot of doctors and a lot of associations from around the country, and you'll see this on our website if you go to About Us. There's testimonials there that you can read as well. So I want to provide a brief update of what we're doing at CCGPP. This is really important. All of our guidelines need to be updated. Every 5 years, the guidelines, when they go onto the National Guidelines Clearinghouse, which we had our guidelines on the National Guidelines Clearinghouse, which is a big deal. It's kind of like the nation's standard. Every 5 years, if those guidelines are not updated, they come off. So we're in the process of updating our low back guideline, our neck guideline, our upper extremity guideline, and our low extremity guideline as well. In addition, we're going to create a new guideline for you. And this is going to be about how to use, when to use, the appropriate time, the appropriate way to use clinical outcome assessment tools. Why is this so important? This is probably one of the most important guidelines that we'll create over the next 5 years. And it'll be done, obviously, within the next 12 months, we hope. But it's one of the most important guidelines. And the reason is because healthcare is changing at a rapid pace. And we know there's new delivery models, and there's definitely new payment models that are already in place or coming down the pike. So fee-for-service, folks, it's going away. We're moving to a value-based healthcare system, and so our payments are going to change. And our payments are going to be tied directly to a variety of variables. Some of the most important variables are the information that insurance companies and third-party administrators are going to collect out of the outcome assessment tools that we need to be using and we need to be proficient at. Things like the oswestry. There's a new one out there called the StartBack tool, which is essentially a predictor of case complexity. The more complex the case, the more we should be paid. But it's important to understand how and when to use these tools and the interpretation of the data to ensure that we get paid for the services that we're providing and the excellent outcomes that we're getting for our patients. So using these tools can literally make the difference between getting paid pennies or getting paid what you're worth. I think it's also important to put this in context. The physical therapy profession is very, very well organized, and they literally have hundreds of clinical guidelines. So we have a lot of work to do. It's critically important that we create more evidence and more knowledge around what we do on a day in and day out basis. Look, there's a lot of evidence out there that supports what we do for spine care. There's no question about it. But we treat a lot of other things that get great outcomes as well. So we must literally catch up. We're behind. We must catch up and create more clinical guidelines. And again, we talked about the 4 that we are going to be revising or updating. We talked about the new one related to outcome assessment tools, but there's a whole lot more work ahead of us to catch up to other professions. So we need you and we need your support. So we're crowdsourcing. We're kind of stepping into the 21st century and we're saying, hey, you know, there's all kinds of crowdfunding and crowdsourcing. Let's do this for our profession as well. There's nothing more important right now that relates to clinical research and what we do in our practices every single day to protect what we do, get paid for what we do, and protect our patients to ensure they get the care they need. Well, we got to get funds. And so please, I appreciate you watching this video, but please click on the link in the email and make sure you can do something to help generate some funds for the Clinical Compass. It could be $10 a month. It could be $100 a month. It could be $1,000 a month. You know, whatever you decide to donate, please just do something because every little bit adds up. $125,000 or so in the next 2 years, and we'll have updated guidelines back on the National Guidelines Clearinghouse. We'll have guidelines for you in clinical practice so you can protect your practice and the patients that you serve. So thank you for watching this today. I really, really appreciate your time. And so please do what you can to help support the profession and Clinical Compass so that we can have a brighter future for chiropractic. Thanks so much.